What is research and why is it important? Hi, I'm Shivani Mehta, your resident research expert at MedSchoolCoach and author of the book Demystifying Research for Pre-Medical Students. And I'm here to cover the meaning of research and why it's a critical part of your application. So let's get to it. First, let's jump into the definition of research. Research is asking a question and answering it using real evidence. Evidence can come from numerical and qualitative data, which we get by running experiments. Believe it or not, we've been doing research since grade school. Remember layering different liquids in a graduated cylinder to see which one had the highest density, or dropping two objects from the same height to test out acceleration? These are both examples of research because you asked a question and then produced an answer by doing an experiment. Of course, the research experience you'll need for med school is not simply doing research projects that have been done thousands of times. Instead, med schools want you to ask questions that have never been asked before. The idea is that each new project will produce a new answer that will eventually help contribute to the facts that we know today. Believe it or not, research exists in every field: biology, history, chemistry, math, anthropology, and much more. And what's crazier is that all of these topics can be connected to medicine. This essentially means that you can do research in anything. But we'll get to this later. Research is often regarded as an important step on the path to becoming a doctor. It's what helps physicians understand the biological and public health context of a disease. It also helps with discovering useful treatments and eliminating harmful ones. When studying for the medical college admissions test, also known as the MCAT, you must read research passages about different diseases and then answer comprehension questions about them. The more you get involved with research and integrating reading into your everyday life, the easier it will be to read these passages for the MCAT exam. So where does research fit into the pre-med journey? Firstly, med schools note that most of us have no prior experience in academic research when we start college, so we're not expected to jump in and just start discovering new things. Instead, we're expected to keep an open mind and make time to learn about the research that's going on around us. This means that first we need to figure out topics that we're curious about, network with different people in the field, find a good mentor, and then join a project that helps you dive into these curiosities. For me, it was sitting in an intro public health course in freshman year and being so fascinated by policies that can shape HIV treatments in the community. I didn't discover this right away. It took a lot of going to different talks, taking different classes, and being introspective to figure out what I liked. But eventually I connected with the right person who helped me explore this interest throughout my 4 years of college. This means that you should take your time to figure out what you're passionate about. There's really no rush at all. We'll get more into how to find your passions and a mentor in the future videos. Students ask me all the time, why do med school admissions want me to do research? The simple answer is, med schools are looking for students who are curious enough to dive deep into a question and patient enough to see the question through. It doesn't matter what you're working on or what you discover, but rather the skills you learn along the way. Let me give you a better example of why it will help you in the future. Imagine you're a doctor and a patient comes in with a cough. This cough could be caused by so many different issues, and chances are you won't know for sure until you dive deeper into the problem and conduct some tests. Maybe it's a viral cough, or maybe it's something severe like lung cancer. To solve this question, you need to be curious enough to think about all the possible diagnoses and patient enough to slow down, conduct the right tests, and wait for the results before jumping to a conclusion. Being a physician is similar to conducting mini research projects every day. A student who can showcase this at an early stage will be valued very highly by admissions committees. When you work on a research question and commit to it, you are showing admissions committees that you have the potential to be a great doctor. There is also an additional benefit of doing research. As a med student and resident, research will expand your opportunities in your education. While research is not absolutely necessary for a med school applicant to succeed, not doing research is often considered a red flag, especially in med schools that are known to be big research institutions. Think about it from their perspective. Would you rather accept a student who already knows how to do research, or someone who has to begin their whole research journey from scratch when they arrive to med school? Experience counts. The caveat here is that people do get into med school without doing research. However, that number is low, and it's likely because they've been doing unique things that are shining a light on their curiosity. Doing research the right way is a great way to look excellent to admissions committees and get accepted.